Hi, Dr. Stowe, and I'm here to talk about the first exam. So obviously there's a lot to cover in this exam because we're going to be looking at the 5 anxiety disorders as well as OCD, which is anxiety related. We're also looking at mood disorders and stress, including PTSD, big emphasis on PTSD. And we really need to understand that when you're looking at this kind of exam, not only are you to be aware of all the symptoms of these various disorders, you need to be looking at the therapies. And sometimes I'll mention a couple of the names of therapists. For instance, big hint, looking at the second generation cognitive therapists. And so, for instance, you'd be looking at Wells and Borkovac. That's just a hint for those of you watching this video about our first exam. All right, we've already said you're going to be looking at 5 anxiety disorders, OCD, the 2 mood disorders, both the depression and bipolar, types of bipolar too, the 2 distinctions between bipolar 1 and bipolar 2, and then of course the stress disorders, looking at PTSD, and of course be sure that you're familiar with the therapies, the best therapies for treating all of these disorders. So for instance, when you're looking at cognitive behavioral, you might want to make sure you're clear about both aspects of what that therapy entails. Drug therapy, we use a lot of acronyms to talk about various antidepressants like the SSRIs, the SNRIs, and then combinations. Then also when you're talking about anxiety disorders, looking at different kinds of drugs that could be effective. For instance, with GAD, yet another acronym for generalized anxiety disorder. We're going to be considering some of the best therapies for OCD, not only looking at drugs, but some non-drug alternatives. ERP, an example, exposure and response prevention. Those are the sorts of things you ought to really focus in on detail. The study guide should be really helpful to moving you through the topics, making sure that you're very familiar with the topics. When you're looking at bipolar disorder, remember that the treatment for that would be quite different than the therapies we use for depression. Not only would drug therapies be useful for the bipolar, they're often the first mechanism turned to help someone even out their 2 moods. When we're looking at mood disorders, we know, of course, drug therapies are pretty successful, but there also are some great alternatives. And when we're considering the alternatives, we would be very focused in on equally effective sorts of CBT. And so make sure that you're familiar with some of those techniques. We might also mention some of the less common and popular therapies. For instance, I think we're all aware that the psychoanalytic therapy that Freud introduced in the late 19th century has really fallen out of favor. And so when we maybe mention aspects of what that entails, you know that when you're talking about psychoanalytic, it's not the same as saying psychotherapy, because psychotherapy just means any kind of therapy. Psychoanalytic is very specific with dream analysis and, of course, looking at various kinds of fixations at different psychosexual stages, using free association to probe the unconscious and so on. And so that's what you really ought to focus on. Make sure you're clear with the symptoms of all disorders, and then therapies. The tables that are in our course pack do a good job of summarizing a lot of that information, so focus your attention on those tables that are at the end of each of the chapters. And so this particular exam one just looks at 3 chapters, chapters 4, 5, and 6. Since you've already done exercises like the client therapist exercise that draws pretty heavily from chapter 3 material, we're not going to be testing on that. And chapter 1 also is a review chapter, not going to be tested on that. So focus your energies on just the anxiety, the mood, and stress disorders, and of course, some of the best treatments for PTSD. In addition, we're also going to look at aspects of multiple personality, otherwise known as DID. So that is dissociative identity disorder, what some of the approaches would be that therapists find useful for helping someone to ultimately merge and fuse different personalities into one coherent and consistent personality. And so those are the sorts of things you ought to focus on in preparation for this exam. I want to wish you the best and hopefully see some really good results when everyone is done, which would be tomorrow at 10 a.m. Okay, talk to you soon. Bye-bye.